Hello again, everyone. My name is Marty Guthmiller, and I am CEO of Orange City Area Health System. On November 12, 2020, bringing you today the 72nd edition of our COVID-19 community briefings. We're just going to jump right into the numbers this morning. Since it is a Thursday, not a Monday, we will not have a local scoreboard. We'll jump right into the county numbers. Across the board, they continue to rise significantly by all measures. And so we'll go through those numbers beginning right now. Sioux County has 3,071 positives per the coronavirus.iowa.gov website as of this morning, 3,071. That is 145 more since Monday. Total number tested, 10,675. That yields a positivity percentage of 28.8%, which is up from Monday at 28.0. The time before that was 27.5. Just as an example, yesterday, on how rapidly these numbers are growing, yesterday our positivity rate in Sioux County was 49.6%. So almost 50% just yesterday. Sioux County, 14-day average. Sioux County is number 9 in the state at 29.7%, just under 30. Previously, we were at 28, 27.2, and 23.3. Lyon County is number 5. Something happened in Lyon County, I'm not sure what. They jumped from 18 to number 5. And they are at 31.7%. They were 23.8, 21.1, and 18.7. So Lyon County has had a significant outbreak up there. Plymouth County, number 10, at 28.9%. That's actually down a little bit, 29.8, but then 26.3 and 23.3 for Plymouth County. O'Brien County, number 19 in the state at 26%, 25.9, 26.8, 25.7. So O'Brien County has been pretty consistent right around that 26% mark. Jones County, by the way, is the number 1 county in the state of Iowa in 14-day average at 48.2%. I think there's a correction facility involvement with that, and perhaps the other two as well. Number 2 is Wayne County at 40.2%. Number 3 is Page County at 37.8. There are also 97 of the 99 counties in Iowa are at or above 12.1%. Significant numbers there to review. Region 3, the 20 counties in Northwest Iowa, hospitalizations are going up. 183 hospitalized in the 20 county region. That number on Monday was 167. Last week we were at 148 and 139. So those numbers definitely going up. ICU rates going up as well, 32. Previously on Monday, we were at 26. Last week, we were at 25 and 20. There were 32 patients admitted in the last 24 hours in Region 3. Not sure that I've seen a number that high in the briefings before. The state of Iowa, we've had 13,544 additional positives since Monday. Total of 170,358 of 1,068,270. That yields a positivity percentage of 15.9%. We've seen steady increase in this positivity rate. The last 4 times, we've 13.4, 14.1, 15.1, and now 15.9. For those numbers to go up that fast, over 1 million test base, again, means that your daily numbers are going up significantly. And in fact, yesterday in the state of Iowa, the positivity rate was 29.2% across the state. Significant number of positives there. Hospitalizations, the number of Iowans hospitalized with COVID-19 are 1,135. That is 143 more since Monday. That includes 69 Iowa residents who are hospitalized out of state. Sioux County has 15. That number is up from 13. Plymouth County, 8 residents hospitalized, up from 6. O'Brien County, 6, up from 3. And Lyon County, 1, and remains 1. So when you look at the 4-county region, really not a lot of growth there. I mean, some from 13 to 15, from 6 to 8, but not the kind of growth that we're seeing in other counties in the state. Woodbury County was 44. They're up from 41. So again, not significant growth there. However, Polk County, again, the county with Des Moines, has 105. They were 85 when we talked on Monday. So they've had 20 additional inpatients just since Monday. And there are other counties or hospitals and counties with significant growth as well, particularly those you could expect with those high 14-day average rates as well. We've had 82 additional deaths just since Monday. The number is 1,927 in our state. Sioux County is now at 21. The demographic continues to be 90% at 61 and over. So those are our statistics for today. Significant community spread. There's no question about it. And we're going to talk about several responses that we can have to that. On a personal note, I am in day 6 of my 10-day isolation after testing positive late last week. I'm still feeling fine and am blessed to have very mild symptoms. Nonetheless, I am in isolation, coming to you from my home, and I do appreciate all the well wishes that I've received. For several months now, we've been talking about keeping your engine tuned. In other words, taking care of your body. There are many things that we can do proactively to potentially minimize the impact of the coronavirus, or for that matter, any virus, in addition to those things that we talk about all the time. Masking, hand hygiene, avoiding large groups, social distancing, all of those things are very important, but they still don't always make anybody, well, they don't make people bulletproof from catching the virus. People will get sick. People will catch this virus. But what we want to try to do is minimize the impact of it. Sometimes that's possible, and sometimes it's not. But here are some other things that maybe some of this is a refresher, but keep your routine care up. Make sure that you're having your colonoscopies, that you're doing your mammographies, your checkups, all those preventative kind of things. You want to make sure you stay up to date with all of that. Immunizations are critical. Flu. Make sure that you get that flu vaccine. We've not gone through a coronavirus season with flu on top of it. We're going into that now. And so let's make sure we do what we can do to minimize that impact. Get your flu vaccine, please. Fitness is another thing. To be active, to maybe lose some weight. We've talked about that. To lower your blood pressure. Diabetes. We've talked about lowering your blood sugars. But be active. Be fit. I'm not talking necessarily about having to go to a gym, anything like that, but get out there and walk, be active. The other thing is nutrition. Eat properly. Vitamin regimen can be something that's important. And again, none of these things make anybody bulletproof, but they increase your odds of milder symptoms, of not being a burden to the health system, so to speak, but most of all, keeping yourself at home instead of in a hospital, or, or worse yet, at a hospital out of town, and all those kinds of things that we don't want to do. And then also the mental part of this is, again, to focus on controlling what you can control. There are things that we simply can't control. We can't control whether we catch this virus or not, whether we do get sick, but we can control how our bodies are preparing for it, as I just mentioned, with nutrition and vitamins and fitness and immunizations and all those kinds of things. So let's focus on those things that we can focus on. And again, we'll get through this together. Every day when I look at these stats, I hope and pray that they're going down. They are not right now. And so we all need to do our part in flattening the curve and slowing the spread. To that end, yesterday there was a press release that you may have heard about that was sent out jointly by all 4 hospitals in Sioux County, along with Community Health Partners, our public health division in the county. And basically what it called upon was all of Iowans to adhere to Governor Reynolds' proclamation that was issued this week. And this spoke specifically to the proclamation of mask wearing, requiring mask wearing in groups of 25 and larger if that event is indoors. And specifically what we were referencing in the press release is to ask churches to voluntarily submit to this proclamation. There is an exemption in the proclamation for churches, and so churches are not mandated to do that. But what we're asking as a healthcare community and as a public health division is for churches to voluntarily submit to that. Again, it's just one more thing that we can do to minimize the spread, not eliminate the spread, but minimize it. And so that's the message that was behind that. And we believe it's the responsible thing to do. And it not only protects others, but it protects our healthcare workers also, which is another important thing. So that's going to be it for today. I will plan on a briefing on Monday again, and we'll have a local scoreboard and bring you up to date on all the activities over the weekend. And so finally, we just ask you to stay strong, to stay vigilant, and above all else, stay healthy. Thank you for joining us today.